Hello, everyone. This is Michelle Niehaus. I am the Program Administrator for Deaf and Hard of Hearing Services at the Kentucky Department for Behavioral Health, Developmental, and Intellectual Disabilities. And I am so excited today to present to you a fentanyl awareness training in American Sign Language with Misty Munton from the Substance Abuse Intervention Services for the Deaf, SAISD program out of Rochester. Today we have Alicia Salier interpreting, and we have Tracy Lundegren on captioning. So you should be able to see open captions, and you should be able to see the interpreter. We are asking that if you can, to keep your mics muted and your cameras off until we get to the question and answer. When we get to the Q&A, we will take questions in chat or in sign language or speaking. You can turn your cameras on for that when we get to that point at the end. And then we'll be joined by our Assistant Division Director for the Division for Substance Use Disorder, Nikki Millward. So I am so excited that you are here today, Misty. Please take it away. We are asking Ron for people to turn off their cameras, please. No worries. I love seeing everyone's faces, but it's easier to see signing when we have fewer screens open. All right. Misty, thank you so much for being here. I'm looking forward to learning from you today.
All right, let's go ahead and get started. Make sure my screen is set up the way that I need it to. Oh goodness, I'm so sorry. I'm a bit awkward and clumsy when it comes to technology. Well, hello, everyone. My name is Misty. This is my sign name. I myself am deaf. And I am an addiction and substance use counselor for many years. And substance and addiction, we don't use the word abuse anymore. That actually changed a few years ago. So I am here to talk about fentanyl. And fentanyl in particular, oh my gosh, has exploded in such a powerful way. We have overdoses that have been happening for a while. And I believe that this particular subject is crucial and near and dear to my heart in particular. I had a niece that passed away a year ago from overdosing on fentanyl. So I'm doing this in honor of her, and I can feel her spirit here with me. So let's go ahead and get started. So I'll be using this sign for fentanyl today. And fentanyl is a synthetic drug, so that means that it is not a true opioid. And initially it was used as a painkiller for surgical purposes. So it was intended for hospital use only. And as far as milligram per milligram, fentanyl is actually 50 times more potent than heroin, and then 100 times more potent than morphine. So even such a tiny amount can be lethal. And I'll show a picture later in those slides of what fentanyl actually looks like. But even the tiniest amount can be lethal. And if you're someone who does use drugs, whether it's, a pill that perhaps has fentanyl mixed inside, and whether wherever you're using it at in your own home, I mean, this is again related to outside hospital use. So if you accidentally get something that's laced with fentanyl, it can truly be problematic because you don't have someone who's there monitoring the use. So, within hospital confines, I mean, it's used for a certain purpose, for surgical reasons, has a purpose, but there are folks who use that who abuse the drug outside of its intended purposes. You can even have drugs that are laced with fentanyl. You have folks who are using it IV. Yeah, so I just wanted to kind of give you a brief overview just for the purposes of this presentation. So we know for sure that fentanyl is dangerous. I mean, clearly, like we mentioned previously, it was initially invented for surgical purposes as a painkiller, but it was intended to be used under medical supervision by a medical team. That way, if something happens and your breathing is compromised, you have medical staff there to tend to you immediately. So I want you to keep that in mind. So the main reason that we have opioid deaths, our main cause at this point, is from fentanyl. And typically it impacts the breathing rates. It slows down your breathing. And to the point that it gets dangerously low. So if you don't have supplemental oxygen there or a surgeon, nurse, whomever to provide immediate medical care, it gets dangerous. And it makes sense if you're using that, medication, like anything else, like morphine, other opioids, you have physicians who are there who are experienced and tending to you throughout, making sure that you're okay. As compared to, outside of the hospital, at home, party, what have you, you don't have those same resources and supports in place. But we do have other resources to try to reduce that harm or the risk of overdose. And I'll go into that a bit later in the presentation. And not many folks, unfortunately, are skilled in CPR. So it's nice to have another option at the ready. You can become Narcan certified. It's a really easy certification to obtain. I'm sure Nikki, the director, assistant director, will be happy to go into that a bit later as far as resources there locally. But it's important to be trained to know how to administer it safely. That way, if you do see someone that you suspect as beginning to slide into that overdose and you're not certain which drug they've used, it's best to go ahead and administer that Narcan just in case you can save a life until paramedics can come and take them to the hospital. It's scary, right? If you don't have the resources available, it's terrifying. So again, that's one of the reasons that, I wanted to have this presentation to spread awareness that we are all capable of stepping in and possibly saving a life. So this is just to show you guys what fentanyl looks like. This is the actual drug. Of course, there's different signs for heroin. I don't know what you guys use there locally, but you can see on the left picture a rather large amount of heroin there in that vial. But then you go right to the one there in the middle. Oh, let's see, I'm not sure if it's transposed on yours or not, but next to that you have fentanyl. And it's the tiniest amount. You can see like there on the tip of the pencil, just that size amount that fits on the tip of a pencil lead. If you have that in a pill or in marijuana rolled up in something, if you have it in an injectable mixed with your Coke, even the tiniest amount can be catastrophic. And it can be lethal to the point that you overdose. So the drug there in the middle, it's carfentanil. That was the one they had intended for elephants to use as a sedative for elephants, whether it's for, surgery. And you think about the size of an elephant, my goodness. I mean, it takes a minute for it to set in, but then that's enough to put an elephant to sleep. So imagine if, you as a person accidentally consume this same amount. I mean, my goodness, it would have catastrophic effects. It's serious. So I just wanted to show this so you could kind of get the idea that, if you put too much fentanyl, oh my goodness, the implications, it's 3-4 times the amount of, another drug. So this was just so you get the idea, just what it looks like and how, how small of an amount and how potent it is. For example, if you have a law enforcement officer who goes in, with the DEA or a SWAT team, whatever that, kind of goes in on a crack house. You may have so many different drugs in there. It could be fentanyl and a slew of others. And there was an officer that did go in one time that went to check a bag, opened it up and thought it was cocaine inside, and went to put something in, accidentally caused the drug to come up and get on his clothes, all over his person, and he overdosed. It was just by contact, being in contact with his face, his clothing, and he overdosed even just from that. So it just goes to speak to how potent this this drug is, and to be careful when you come into contact. Unfortunately, during the COVID years, Kentucky was one of the leading states for the highest number of overdoses and fatalities. Yeah, Kentucky had one of the highest percent. So I'm still learning. I don't live in Kentucky. I'm not from Kentucky, but Nikki had helped me out here. So I wanted to speak to that point. And I think they have come up with approximately 2,083 recorded deaths from opioid overdose, and that was in 2020. So we want to use that statistic to look at harm reduction strategies. And I want to go into that concept. The best way to approach, harm reduction and reduction in overdose. It does seem like Kentucky has been a bit behind previously, but I think they are caught up to more states now in providing test strips for fentanyl. So that way folks can test to see if something has fentanyl mixed in it, and that way they know that that's not a good batch, and hopefully they'll dispose of it. And that's really good news. So we've looked at the data, we've looked at the research, and it seems like the best strategies as far as harm reduction and reducing that number of opioid deaths, or overdose and then come back to only repeat that experience later. So I mean, it seems to be pretty accurate, that when these are used in the right ways, they're pretty reliable. And I'm not sure if you've heard the term analog, but it means that it's a similar drug. It's like a copycat, so to speak, of fentanyl. And another synthetic opioid. Could be morphine has some. It seems to be like it's similar to those original opioids. I have a video that I'll show later if we have time, but it talks about the test strips and how to use those. So this is what I was talking about a moment ago. You can see there's so many different analogs. Fentanyl is known by so many names, but these all operate similar to fentanyl. I don't know if you saw the one carfentanil. You can see that like fentanyl inside. There at the end, sufentanil. But those are all used for different purposes, but what they have in common is that they're pretty potent and they can be really harmful if you abuse them or use them outside of their intended purposes. Most of these they're supposed to be administered and monitored by a medical team. Carfentanil is more for veterinary purposes. So veterinary, surgery for elephants or larger animals, that was not intended for human purposes, but you get the idea. So the most important thing that I want to talk about, and the reason hopefully you're here, is this. So we talk about the idea of harm reduction. Now, does reduction mean that we're going to cure this and then we're never going to use fentanyl and there's not going to be any more overdoses in the world? I wish, but that's not the reality we live in, unfortunately. But what we can do is use those harm reduction strategies to make an impact, to empower folks, drug users and those who suffer from substance use. We could try to, help them minimize that use, or to at least become more aware of the dangers. Instead of preaching at these people and, coming up with really hurtful stereotypes, we don't want to do that. That's too stigmatizing. So we want to remove that from the picture. Because anytime we add judgment, and of course, that's going to escalate things. It's going to make it worse. What our people need are support. And of course, they know these things are not legal, but they just need support as they battle through this. But the best thing that we can do is to remove that stigma. But the general idea of harm reduction is to abolish harm in healthcare, policy, education, and prevention. Those are all crucial legs, that educating, spreading awareness. Without education, without awareness, the ignorance will escalate and folks will continue to be unaware of the ways that we can reduce harm. And that adds to the shame and the isolation. So the more that we can spread awareness, that's the reason you all are here today. And thank you so much for coming. I'm still learning myself every day. So we're all in this same boat together. But as far as harm reduction and the benefits, it's to hopefully dial back on the use. It's to support families who are impacted by use and communities overall. I'm not sure in Kentucky if marijuana is legal, but recreational cannabis is allowed here in New York. They did just add a new law as far as like for the dispensaries to make sure that the weed, edibles, what have you, that way, you can go to this place to buy them versus going out on the street and buying from a dealer and unfortunately getting some of those dirty drugs. I have heard a bit, people have heard a bit about fentanyl, and so some of that awareness is spreading. Going back to that harm reduction. Again, it's not to entirely eliminate or to come in with, pat trite slogans of just say no. That philosophy is outdated. I like the just say help, again, and spreading that awareness, getting that out there, providing support to people who are using. There is, medication replacement, like, example for like nicotine, you have someone who's been smoking for a long time and who needs help quitting that. I think they have like NRT, it's nicotine replacement therapy. You can get a free patch, there's a website for that where you can access those for free. Because you have folks, that can't quit cold turkey. Some people are able to, and my goodness, but a lot of times I've noticed those folks will tend to go back to using again later. So those patches and replacing that tends to aid them in weaning off. Or even for marijuana, you have people who use frequently, and that's when you come in, you ask, how often are you using? And they may be using pretty much consistently. So that's when you come in and discuss, like, can we talk about a reduction? Maybe Monday and then skip Tuesday. There's options. It's a similar concept, but the idea is to reduce. And then you can bring in counseling as a support, or people, loved ones in their life, to come in alongside them as their support system. And I'm sure Nikki can help answer some questions at the end. But I thought it was really neat that Kentucky supports harm reduction. They have a program that's exciting. So if you do want to learn more, if you have someone that is using but seems to, be embarrassed and wants to isolate, you may be able to give them this link. If they're not willing to talk about it more openly, this may be a good resource to point them to. And there's a map that opens up and it'll show locally where you can get testing strips or other resources. They also have like a needle replacement program. There's Narcan support and sponsorship. Really, it's a phenomenal program, and it's pretty clear and easily accessible. I don't like to use the word addict. I'd like to say someone who is suffering from substance use disorder. If they're like, hey, I don't have a computer, I don't have access to the internet, where do I go? You can point them to the library, or say, hey, like, do you trust me to go with you? We can sit down and do this together. It's whatever works. Even pull up your phone. Whatever you feel comfortable with, but that confidentiality, a lot of folks really cherish that. And you will hear me emphasize this 100 times over, but this is where it's at. This is the key to reducing our numbers of overdoses, clearly. So as far as examples for harm reduction strategies, for a person who is opioid dependent, like, for example, we'll use fentanyl. If they are dependent on fentanyl, that person may have no idea that they've had fentanyl laced in their heroin. And again, this is totally a fictional example. But they may not even recognize that they are slowly becoming dependent on fentanyl. I mean, these stories do vary. I know it's pretty complex. But the idea is, if you have someone who, again, for example, is getting fentanyl in their heroin, what do we do? How do we help them? How do we help them reduce this harm in that circumstance? Part of it's education. You may step in to say, hey, don't mix fentanyl in with your other drugs. Like, we don't mix alcohol and pills or heroin, what have you. Mixing those different drugs is going to worsen the impact. I mean, it can really mess with the chemicals in your hormone system in your own body. We also can step in and say, hey, please don't use alone. Make sure you have someone, a trusted person with you. And they may balk at that idea at first, but that's where we can step in and say, hey, if something happens and you do accidentally overdose, what is your plan? Like, what's going to, you may risk your life that way. If you overdose without someone there, who's going to be able to call 911 on your behalf? Or I'm not sure what the different systems Kentucky has in place, but that person, who's not using will hopefully be able to step in and administer Narcan. And that brings up, Narcan. It's always good to have that on hand just in case. And I am not an expert on Narcan. I am certified to administer, but I can't provide a whole lot of, I don't want to give any kind of misinformation here since I am not a certified trainer. But I do know for a fact that Narcan does save lives. I'm telling you. And if you don't have Narcan at the ready, then that's when you try your best. You call an ambulance, you do CPR in the meantime, you do whatever you can. Another thing we can recommend is using fentanyl test strips. So let's go ahead and talk about that now. That's when if you're not sure if you have fentanyl mixed in your drugs, it's best to go ahead and test just to be on the safe side. So I guess I have a question for you all. And it may be a bit complicated, but I guess my question is, how do your users in the area know about these strategies? How do they know about the testing strips? That's kind of the problem. That's where it goes back to spreading awareness. That way folks can become familiar. I mean, it may be a good reminder, if someone is high at that moment, let's, go ahead and test. I mean, that's the challenging part. I'm hoping, again, that Nikki will be able to help us answer some of these questions about what you have locally. I know it's complicated. My sister, my niece's mother, she's not super supportive of that, but, she understands, again, my niece at that time that didn't have any of those resources. And so that's why I'm here to continue spreading that awareness and education. Okay, this is pretty complex. And as far as, instead of going into all of this, I just want to go to the place where it shows how to recognize on the strips, how to identify whether it's positive or a negative strip. I know this is a lot of information to take in on this slide, and so I myself get overwhelmed by it. I assume some of you all may too, so I will just show you the picture in a moment. And I can share the PowerPoint with you all at another time. But I do want to go over to those positive and negative test results. It's a bit odd. Okay, so backing up to this part. So finally, the state of Kentucky passed a bill. I know that that's been a battle fought for a few years now. It seems that the idea is that, Kentucky feels like this may enable folks to continue to use even more drugs. I think that's the misconception, but truly, the truth is opposite. It's really the best way to reduce the number of overdoses. I mean, of course, these are illegal substances, and there may be folks who think, oh my gosh, you're already doing something wrong. This is terrible. But, people who are using, they don't care. We can't, twist their arm to quit. So we can provide them fentanyl testing strips just so they can see if their drugs have fentanyl laced in or are even more unsafe, and then hopefully they'll dispose of them. And of course, these are passed out without any questioning. There's no judgment when people come in to grab these strips. It's a completely confidential process. There's no, it's anonymous. There's no record of names. Folks just say, thank you for coming, and then pass them along. And the idea is that, again, tell your friends. So hopefully the folks, who are using are going out and telling their friends to come, that this is a safe place. There's no, law enforcement who's monitoring, hoping to bust people. It's a really great program. And they've been fighting to get this program set up for a while, to get the testing strips available. It seems to be more of an issue in southern states because typically in the South is when we have the highest rate of overdoses compared to the rest of the US. In total, it's about 34,000 deaths that have occurred in the South, including Kentucky. And we haven't seen a reduction in the number of deaths since 2020. So that's when they decided to let's go forward with setting up the program for the testing strips in hopes that we are able to reduce that number of deaths and overdoses. So hopefully it'll be twofold. And I know that there is a lot of stigma, against fentanyl. I hate that my niece is a statistic. She, and again, I feel like she is here in spirit to help educate us all about fentanyl. You know, to speak on behalf of all the young folks who have died. And the best approach is to educate other people. And overdose have, you know, beat, I mean, my gosh, automobile and the number of automobile accidents, and it seems to be in that 18 to 45 age range. I mean, it's the leading cause even over COVID. And these are numbers that I've gotten from the CDC, by the way. But yeah, my gosh, these numbers are staggering. But the good news is, you know, the test strips themselves. And then, not Michelle, but I think it was, I forget, my supervisor and some other folks. I went around and was asking, you know, if you have those test strips that you've already used, like, what is the appropriate way to dispose of those, or what do you do with them after? So I went ahead and emailed Monroe County, that's here in Rochester, the health department, their division director, and got a great reply pretty soon after. And I wanted to share with you all what they had said. And they said that they had never really heard of, as far as like those strips, like anybody having any kind of overdose from those coming in, you know, coming into contact with those later. So really, it doesn't propose a risk. You can put them in your regular trash can. You can see right here, it says Dance Safe. That's who makes our strips. But they said that, you know, there's no risk as far as those like polluting our water system or doing something with our trash system. So yeah, you can dispose of those in your regular trash can. So that's good to know. I see a lot of comments in the chat. I will get to those. But here on this slide, you can see there's the fentanyl test strips here. So the red line, wait, hold on. Let me make sure that I'm not telling you incorrectly. So red line means that it's positive for fentanyl. So it's a bit odd. It's like one red means that it is positive, two lines means that it's negative. So it's probably a little bit confusing. I'm thinking about the pregnancy test. Two lines means positive. So this is a bit flipped. So if you see two red lines means that that is negative for fentanyl. So if you do see a positive strip, then that lets you know that it is best to dispose of those drugs. You know, if it's positive, it's one of those things I don't like to say it, but it's one, like, you know, it would be a drug that's safe to use. I hate to say that because that feels a bit oxymoronic, but that's the concept. And like I said, I have a video that I will show you. So I think I'm still flipping those around. Yeah, the one on the top. So one line means positive. So I'm sorry, then the two lines means positive for fentanyl. Yeah. So please correct me if I'm wrong. So there is a website available that you all can use. I mean, really anybody can use, where they will get these sent for free. You just go in and send in your mailing address, and they will ship those out to you. This is great for if you live a bit further away. You really don't want to go in and, the stigma of like going in and asking for these in a certain place. So you can send in your mailing address here, and they will mail those to your house. And I'm sure there will be a link more particular to Kentucky here pretty soon. And again, I'm not an expert on this, but from my understanding is if someone would like to order the fentanyl testing strips, and I will abbreviate that FTS, that they are allowed to use, or they get like a discount using their core money. I'm not sure if it's discount or for free. I'm not sure exactly, but I'm sure Nikki is aware of that. And if you would like to order the strips or Narcan, then you can look at this website here and get more information on that. And again, I'm sure you have to just put in your mailing address and they'll ship it to your house. Or maybe even pick it up locally. I'm not sure. Whatever you want. Let me see if this will open. This is a great video. I think it's about 5 minutes. Let me check our time. Oh, we've got plenty of time. But let me see if it works first. Fingers crossed. Hmm. I am terrible when it comes to technology. Oh my gosh. Oh my gosh. Michelle. Hello. Help me. Would you mind opening it up? Well, and you can copy the link too and put that into the search engine. That'd be easier. Okay, one moment. Well, honestly, if this is going to be stressful, what we can do is we can just send this out in the PowerPoint later. That way we can wrap up and then open it up for questions and answers. And Misty's saying, yeah, I think so. I love the question and answer portion. I do apologize about the video. I was able to watch it on my own. It's a wonderful demonstration on how to use the testing strips. I think it would be great for you all to see. And my sorries about that. Okay, so you get the idea. So on your own time, go into YouTube and you can type find help now, Kentucky. And there's some great videos on there in sign language that's talking about where you can go for help. You know, if you suffer from substance use disorder and you're having a hard time quitting, there's a wealth of information there. It's great videos. It's a little long, but on your own time, I believe it's like 7 minutes, but it does have captioning and it does have audio, but also in sign language. Yeah, I had no idea that you all had that. That was wonderful. It's a great idea. What is happening? Oh, maybe that was it. Okay, I guess it was. I guess I am done. Okay, then this is a great time. Let's go ahead and open it up for discussion and questions and answers. I would love that. So the first question is from Amanda Friend. Let me pull that back up. Where was fentanyl made in the first place, and what was the purpose for hospitals to use fentanyl? That's an excellent question. And I will give you the answer to the best of my knowledge. My sister sent me something so the Arizona recently, they had seized a lot of fentanyl. There were a lot of pills that were made to look like candy. I think it was Smarties in particular, or like those like sweet tarts, like the light colored candy and the purpose was to trick kids into taking that. But they were able to seize, all of this. And then they got that. It was a shipment from the cartel in Mexico that had smuggled it across the border. They had made it in Mexico, and I'm sure it's mixed with, oh my gosh, I don't even know. I'm sure there's opioids, some other, cocaine, what have you. So it kind of relates to the second part of the question. How did this get so widespread to our communities? Well, the how of it, I'm not sure. I can think of one example. There was a drug dealer. And a customer, who kept a repeat customer, thought this is pretty good profit. They loved the high. They went back to the same individual. So that was when, they snuck in, laced the fentanyl in with some other stuff, heroin perhaps. So they were mixing it up and then selling dirty drugs on the street. And then there are some folks who just know they like the high. They feel like it gets them a different, better high than just another drug alone without being mixed with fentanyl. Some folks were lucky, maybe not lucky in a good way, but they've overdosed and still been fine. Then you have people, who have used it once and then it's fatal. So I think it goes back to, how different folks tolerate different drugs. Yes. If you want to go ahead and turn on your camera, if you want to ask a question directly, like Virginia, for example. No, sorry. Hello. Hey, you saw my question there. I mean, honestly, I knew nothing about these testing strips, so that's really good to know that we have that as an option. Can you use that to test any kind of drugs out there? Does it include working for a pot? I'll watch the video later, but I'm just curious, how you use that on the various drugs. Oh, that was a phenomenal question. Thank you. I am learning about the testing strips as I research and go along. But the testing strips, oh my gosh, you can test anything. If you have any kind of drug that you think, oh my gosh, may have fentanyl laced in there. Some of the tests, can also have those analog, the fentanyls. But again, if you have anything that you feel like is too risky, that's when I recommend disposing of it. But marijuana, weed, however you want to call it, that's impossible to test. Maybe they'll have a new method they'll come up with later, and you may correct me if I'm wrong later, please. But from my understanding, as far as, I don't think there is a big risk for fentanyl and marijuana, because you typically have to, melt it down to that powder to be able to mix it in. They usually, things are kind of crushed out. Oh, hey, Nikki's here. Be perfect. Hey, this is Michelle.
I'm getting all kinds of questions in the chat, but I asked Nikki to just pop on and give us a little bit of an explanation about her program and what's available here in Kentucky. And then we'll go back to more of the Q&A. There's a lot of questions related to how did this spread? Why does it continue? Why doesn't it stop? But before we kind of discuss that and theorize about that, Nikki, could you just explain a little bit about your role and what they do at the Division for Substance Use, please?
Yes, I'm happy to. So here in our division, we look at across the continuum of care for patients. So we look across harm reduction services, treatment, prevention, recovery supports, to see how we can engage individuals in Kentucky who need help with substance use.
This is Michelle. So you work with the community mental health center system and with all kinds of other treatment providers. trying to increase awareness and increase access for treatment. We have on the call, we have several people who are vocational rehabilitation counselors, folks who are in the deaf community as trusted deaf leaders. And I know that Misty mentioned that we just have to build this awareness. Do you have recommendations or thoughts on how you've used champions in the past to help increase awareness and how to build networks of support for people?
So our community champions are really important in this work, getting the outreach and the word out there. So it's important to kind of engage with your local health departments, regional prevention centers. Those are going to be your groups that have relevant information that is able to reach your different populations.
Thank you. And these questions are for both of you. I have one question. Did fentanyl come from drug experts for hospital use? And if yes, how did it get out?
So fentanyl was FDA approved, I think in 1960 for pain management. And it's an incredible medication in a hospital setting for acute pain. In the beginning, I think we saw a little bit of that hospital grade fentanyl being diverted. So like the fentanyl patches maybe getting out, and you would see people using those. But we've seen a transition in the last several years to lab created synthetic fentanyl that's been created outside of the US that's coming in via the cartels.
Then we had another question wondering, how can professionals be safe? What happens if they're working with somebody who comes in and has fentanyl on them? They're worried about their own exposure to fentanyl, or kind of like the story with the police officer.
So there's safety precautions, right? We definitely want to make sure that we're safe. Fentanyl, if absorbed or inhaled or come in contact with the face, could be potentially harmful, right? So if it's getting into our mouth or our nose, but our skin, it hasn't really shown to be a huge issue yet. So as long as we're wearing gloves, we're covering, we're not having that direct kind of inhalation or through the nose or mouth, it's pretty safe to kind of move the drug. Make sure, like if somebody's overdosing, it is okay to still engage with that individual.
Misty
Thank you.
said absolutely, exactly.
The risk is pretty low, really, of
Yeah.
getting hurt to that point. And we can offer naloxone training as well. We have done that in the past with Voices of Hope, and we hope to offer that again. So if there's interest in that, please let us know. This Lunch and Learn series is something we're just getting started. So if there are topics that you would like to see more of for professionals and for members of the deaf community, drop it in the chat or email me if there's other topics you would like to see us address. Does anyone else have questions for Nikki or for Misty? We will be sure to send out the PowerPoint to everyone. And the 2 videos to watch are the ones on fentanyl test strips and the Find Help Now Kentucky website. Both of those I think are great to share as well. Put it on your social media, put it on your website for your agency, help people know that this support is available. And I think Dodie might have one more question. If we confront someone that says that they use drugs, should we go ahead and sit and talk about it? How do you address that if you think that somebody might be using? That's a big question.
Yeah, it's a very big question. I think it depends on the individual. Do you have that rapport with them? Because you can't force a person to disclose to you. You can just say, hey, I'm here to support you in whatever you need. So I don't know if Nikki wants to add anything to that.
That was a good answer, Misty. I think it's just important that we treat everyone with respect and kind of just be there in a non-stigmatizing way, that if they need help, we're going to help connect them with different resources, and understanding that help looks different for everybody. It could be just starting with harm reduction services, connecting them with individuals there to help. You know, if they're ready for treatment, Find Help Now KY that Misty shared is fantastic. But I think it's always just remembering that, you know, they're a person. We're going to be respectful and just help them along the way.
And I agree 100% with what Nikki said, definitely. You know, and what I see as help, I mean, it can be simple. It can just be be there. Say, hey, I'm here. It's as simple as that. You really don't have to say a whole lot. That's my take.
This is Michelle. We are also trying to build our peer support network. Sometimes a person who is deaf or hard of hearing is afraid to reach out to another person who is hearing because they may not understand the communication barriers. They may not understand that lived experience. And so Ron just popped on his screen. He is our deaf certified peer support specialist. And I'm guessing he's going to have great things to share with you in a second. But we are also recruiting for new people. So if you do know someone who is in recovery and they would be interested in becoming a peer with our department, please have them reach out to me. We are really trying to grow that network. We are also open to having people who are hearing, but are CODAs, children of deaf adults, or siblings, and have that life experience and can communicate with the deaf community. So we would love to have more folks. Ron, what do you have to say today?
Well, thank you, Misty, for explaining this. And wow, I learned a lot from your presentation today. It was wonderful. It's a lot of stuff that I'm actually filing away and want to think about later. But when you made the comment, as far as addict, instead of substance use disorder, would you mind to go into a bit more detail with that? You know, what is the stigma? And is it as far as just feeling like there's too much stigma, too much negative stigma with that word addict? I mean, I'm just curious your thoughts, but I really appreciate your presentation today. And one, Misty saying, you know, even sometimes I have to correct myself. You know, and words are constantly changing, you know, and we try to just go with that flow to find a kinder word that's without that judgment and stigma. Well, thank you for that explanation. I did have something else. I have a client. Talking about fentanyl in particular. I'm sorry, I'm going to have to ask Ron to clarify. One of the clients that I work with has a roommate who's also using drugs. So I've tried to talk to my client about how do I talk to them about their roommate. Are you saying client or patient? Well, I'm a deaf peer support specialist, so I go out and work with different folks and try to help them in their recovery. Well, that's wonderful. So you are meeting with your particular client and they express to you about their roommate. Is that correct? Okay, so they were talking to you about their roommate. Oh gosh, I wish that, oh my gosh, I'd love to work with you. I mean, really, we can't do anything, you know, for his roommates. I mean, we can support your client in particular. You know, that's, you know, if that would be more the focus, as far as like, reducing the harm for them or something. Yes, Michelle.
This is Michelle. One of the things we're trying to build for people who might feel isolated, maybe it's a deaf individual whose roommate is the only person they communicate with. Through our Kentucky opioid response effort funding, through that core funding, we have recovery community centers that will provide interpreters and are hoping to build more events where deaf and hard of hearing individuals feel comfortable coming in. And so by building those networks of support, it helps build what we call recovery capital. And then it helps people to feel less isolated so that maybe the person you're working with would then feel like they're building new communities and they're able to have more people who are in a recovery lifestyle and then have less dependence on the roommate. And then maybe by seeing that, the roommate would also be interested in having that kind of life as well. But like Misty said, it's about not judging and it's about supporting and meeting people where they're at, not about confronting. It looks like this was an important topic, and I'm so glad we had a great group today. Please reach out with other topic ideas, and we will be offering, hopefully at least once a month, a lunch and learn for the deaf and hard of hearing community. So thank you so much, Nikki, for joining us. And thank you, Misty, for a compassionate and warm training with vital information. And may we all be able to take the spirit of your niece and prevent this from happening to other people. So thank you, Alicia and Tracy, for your language access. And I hope you all have a wonderful rest of your day.
Thank you.
Thank you.